Dr. Andrew Moran, I'm a physical therapist. I wanted to spend a little bit of time talking about patellofemoral pain syndrome. A lot of runners encounter this kind of pain system, this injury, so often that they call it runner's knee, and that's a lot of times how we hear it talked about. And so what I want to do is spend a little bit of time just talking about how this typically comes on, as far as expectations, what they are in terms of rehabbing it, and transitioning back into running, so you guys have a better idea of what exactly you're looking at on the front end of rehab, so you have a better understanding, you feel more confident with it. So I have an anatomy app here that I want to walk you through. And as far as patellofemoral syndrome, essentially what that means from an anatomy standpoint is when we look at the knee itself and we kind of zoom in, we have this structure called the patella, right? And so this is going to be called the anatomy, kind of the more medical terms, patella, otherwise we know it as the kneecap, right? And so essentially what is happening here is we have a pain referral that's being sent up to the brain through the sensory fibers, and essentially that can be due to the way that this patella articulates with the structures underneath it, okay? And so with any joint, there's going to be synovial lining, synovial fluid, and so oftentimes there can be irritation underneath this patella, where this patella basically comes into contact with this bigger bone called the femur, right? And so a lot of times we need to look at how this patella is being controlled, both in a static position and as well as dynamically, especially with runners, right? Every time we come into contact with the ground, we know the research demonstrates that it's 2 to 3 times our body weight that's coming into contact with the ground. And so we have to make sure with our runners that we're able to basically dynamically load and control as part of energy storage and release, right? With each time we come into contact with the ground with the lower extremity. And so what happens with patellofemoral syndrome is if there's a few different maybe instances, or there's a few different reasons that can lead up to this area being irritated, whether that's the overall volume, maybe it's overuse, maybe there was a previous injury in the past that sort of predisposed a person to have increased loading of this patella, and therefore compression of the structures that kind of run near or underneath this patella. A lot of times that is what can precede an injury or pain to this area. So a lot of what we deal with is how can we basically control, load, and dynamically control this kneecap and this knee joint, and that's what we kind of work through with our runners in physical therapy. So a lot of it is built on how can we empower runners to feel more confident in their knees and then accelerate them into a return to running program. And so I hope that gives you a little bit of a snapshot of exactly what we're looking at in terms of patellofemoral syndrome. A lot of it is how can we control this kneecap so that when we do go to dynamically load it, and we start to sort of get into more of the muscular control side of it, right? How can we get it to the point where this knee muscle actually can control, and you can see how it articulates there as it slides kind of within the femoral groove. How can we get it to where that's more easy and less, more tolerable and less painful for it to do, especially with runners as we return to running. So hope that helps. Have a great rest of your day, guys. If you have questions on any of this material, feel free to reach out to us via email on any of our content that we're putting out, or give us a call. We'd be happy to answer any questions that you have.